Illicit fentanyl is surging in Oregon, and it's deadly.
And every death is preventable, and we can do better.
Last year, Oregon overdose deaths increased 41%, compared to a 16% increase nationwide. That's according to the National Center for Health Statistics. Wednesday, a call to action and for awareness to protect teens.
It is a different beast, and it is absolutely vital that we do what we're doing here today.
An OHSU roundtable with community health leaders, school nurses, advocates, and parents. Parents like Jennifer and John Epstein.
Our family was forever changed.
In December 2020, they lost their son Cal to fentanyl poisoning. He took what he thought was oxycodone, but the pill was actually fentanyl.
Since Cal's death, we have learned a tremendous amount about fentanyl, fake pills, and the deception that is going on by drug dealers.
The two are now on a mission, working with the nonprofit Song for Charlie.
This particular component of the opioid epidemic or the overdose epidemic is really new and different.
Fentanyl, a synthetic opioid, is 50 to 100 times more potent than heroin, cheaper and easier to manufacture, and more addictive. It also carries a greater risk of overdose, especially for young people with no experience using opioids.
The counterfeiting and deception issue. You put those things together and you have a really lethal combination. These pills are everywhere. There's a hockey stick of growth of these counterfeit pills, and they can't be told apart.
Even as the death toll continues to rise, teens don't seem to understand the risk.
In our research that we've done nationally, we understand that only a third of teenagers understand what fentanyl is.
The roundtable called for more awareness at every level to broaden access to education and treatment.
We need to educate families, we need to educate students, we need to educate teachers, we need to educate coaches. We need to educate healthcare professionals about the risks of fentanyl so that they can talk to their patients.
Brittany Folgers, KGW News.